Is the Executive Director, Nurses and Air, Ayodeji Olabi. Good morning.
Good morning, ma.
All right. I also have the Executive Director, Royal Nursing Consult, Julie Mogbo, joining me via Skype. Julie, good morning. Thank you for joining us.
Good morning.
Now, let's begin with you, Julie. A lot of persons have said, and even from reports, Nigeria's health system has been overstretched with this pandemic, and that has left those on the front lines vulnerable to the whole situation as it is being reported. Talk to us about the vulnerabilities that you have witnessed and those on the front line have witnessed in the past 1 year.
Thank you. Thank you very much, Veronica, for having me. Well, when we talk about the situation with our healthcare system, it is no longer news. For those who didn't know in the past, the Covid-19 pandemic has exposed the gap that we have in our healthcare system. So almost everyone that I know has one or two things to say about the deplorable state in which we find ourselves when we talk about accessing healthcare and then having the right equipment and sufficient manpower to take care of the cases that come in now, not just the COVID-19 cases. For the health workers, when this whole thing started, there was the fear, and understandably so, because they have been in the system before COVID-19 breakout. We already have been crying about the state of our healthcare system, not having enough consumables to work with, having to borrow materials from one patient to care for another. So these things already were frustrating frontline workers, especially those within the clinical setting. So we had that before the COVID-19. So when the pandemic broke out, the fear just skyrocketed. So they had the fear of how can we care for patients when we know already that we do not have enough materials to attend to the non-COVID cases. So they had to deal with not having sufficient consumables, not having the right equipment, not having oxygen, because we literally borrow like everything, not sufficient oxygen cylinders to care for patients. And we know how critical this is in the management of COVID-19 cases. I think that if we had enough equipment, clinical equipment, I think we may not have recorded the much death that we have recorded. So that is on one part. Then the other part is the remuneration, not having sufficient salary. It is sad to find out that there are still some state governments that are owing staff, health workers salary. They are owing them salaries. So not having enough. We have people who wanted to resign. We have people who are troubled. We are not being paid. How do we fend for ourselves? Some health workers were told, it is your life, it is your health. If you are not giving face masks, you need to go acquire one. So if they don't even have the money to pay, they are struggling to pay their way to work, how will they buy these consumables that are used on a daily basis? It's not something that you have to repeat. Then we also have the mental and the psychological part. At this point, they're dealing with a whole lot. With the economic situation in the country, it is quite difficult. I know we have said this over and over again. Some of them were scared to go back home. They had to find a way to stay away from taking this virus and infecting those at home. We've had healthcare workers who have infected their spouses, and this is still weighing down on a number of people. So they had a lot to deal with and are still dealing with as we speak, even as it is close to a year. It's about a year since the pandemic encroached into our space.
All right, let's bring the conversation to the studio now. Yodeji, from what she has said, a lot of things talked about remuneration, talked about availability of required equipment, and that if all of this were in place, the number of deaths recorded, we wouldn't have had that. Okay. Do you share the same view with her?
Okay. Sometimes last year around August, we did a documentary around what healthcare professionals are facing. Most of them have this fear of coming out to speak that they are facing so and so, because it has been said that if you appear on any news or any media platform, you're going to be sanctioned.
To complain?
Either to complain or to say anything, you're going to be sanctioned. That is, if you're not going to be sacked. Something happened recently in Ogun State. About 2 nurses were sacked for coming out to talk. That's by the way. In the epicenter here in Lagos, I was told they're only giving 1 N95 per week. 1 N95 per week.
Is it reusable?
It is not. So their life is at risk. A lot of people are just going there because some don't have any other thing to do. If they quit their job, how would they fend for their family?
It is the commitment they have made to humanity.
Exactly.
Service to humanity, yeah.
And some, when they fall sick, they have to pay a certain percentage for their own treatment. Some, when they are, I was told they're just being given face mask, and face mask is only effective in some cases. When you're doing any procedure that aerosol will be generated, N95 have to be used, aside using the full PPE. Aside that, their welfare is zero. So the allowances that is being paid stopped around September.
Last year.
And some were employed in January when the second wave was much. Till today, they haven't been paid anytime. And yet, they're still going to work. Some of them felt sick in the course of doing that, and they have to pay for some certain medication. Some are free, which is also free for some patients. But to others, also, they have to pay for their own medication. So this commitment is going down. Some, they are afraid, just like you said, of transferring the disease condition to their own family. And, you know, the incubation period is between 5 to 6 days and sometimes lasts for like 14 days. So within that 5 to 6 days, if you're not even showing any symptoms, you don't know whether you have the virus, and you're going home to meet your family, to meet your loved ones, you don't know whether you're transferring it to your family members. So the fear is there, the stigma is there, and yet they're still doing the job.
So the implication of this now, because we already have a situation on the hand, and there is Ebola, which we say we are to alert for. If health workers are facing all of this, what are the implications? Not just for them, but for the community, the society.
Now, when an health worker is sick, it reduces the work force, and it reduces the number of people that will take care of people when they fall sick. There will be a lower effectiveness in taking care of anyone that falls sick. There will be more workload for anyone that is available to care for people that fall sick. There was a time recently I went to volunteer to take care of people at the COVID center. But when I heard a lot of things, I had to go back because my own life is very important to me. Than going there, sacrificing my life, and at the end of the day, nothing to show forth. I would like to say kudos to everyone out there caring for patients day in and out, doing everything they can to make sure people are coming out fine. Even the psychological effect of seeing your patient dying. You don't know whether you're going to be the next one. Seeing your patient falling sick on oxygen for a long period of time. We have
recorded cases of even health workers dying, which also has contributed to the mental health state of some of the workers, which some other persons have talked about that we need to pay attention to, because watching the workers, their colleagues die is also sends a strong message to them, which I want to take to Julie Mogbo now. You have had our guest in the studio, Ayodeji Owolabi, talk about a lot of things, but this issue of watching a colleague pass on as a result of, in the line of duty, basically. I mean, the mental challenge, the mental torture, and the stress, alongside the stress of work. How much of a challenge is this? And what are the implications to addressing the pandemic and every other case of disease that might come along the way?
All right, so we have many of us may have heard that the mind is the powerful tool. It is a powerful tool, and somewhat because of the activities that go on in there, we tend to create our experiences. One of the challenges that we have had in the clinical setting is when our patients give up even before they die. This is before the pandemic. This is the normal thing we deal with. When we know that a patient has a chance of surviving, but because of the state of their minds, they tend to give up even before they give their last breath as a result of the medical condition or the disease. Now, health workers, upon seeing this, initially I didn't understand when I got into that space. When someone dies and a health worker behaves as if it doesn't matter. It was much later when I got into the core clinical that I understood that you need to save your sanity. Because if we allow ourselves to get carried away emotionally each time a patient dies, it's going to affect us and we will be incapable and inefficient in handling our responsibilities as we are called to do. So bringing it to the current situation we find ourselves in, finding a colleague die, it's only natural for a fellow colleague who is still alive, then especially those that already have pre-existing medical conditions, to start harboring that fear of, am I the next person? They know the disease process. They know the complications. They understand the risk factors involved. And yet they still have to go to work. It is a very critical issue that we need to pay attention to. We recently nursed a veteran medical doctor who passed on in Nigeria, a very great person that we lost there. The nurses who attended to him said something. He said, I am beginning to manifest psychological symptoms that my patient was manifesting. I have experienced the same thing. When I nursed a patient who had cancer and she passed, I had to do a lot of mental detox in order for me to retain my sanity. When I was called upon to accompany another patient abroad, I said, no, I'm not in the right mental state to take on this job, no matter the amount you're going to pay me. So if we need to pay more attention to the mental health of healthcare workers, especially those in the clinical setting that have their hands on taking care of patients that have them. So they have the manifestations of the patient they are handling, and then they have to deal with their colleagues dying and passing as a result of the condition they are managing. So it's something that needs to be addressed. And if we do not, it's going to weigh on our ability to manage COVID-19 and to curb the spread or to bring it to a halt. If we are succeeding, then there's so many backs are breaking to make that happen. And I really applaud every health workers, my colleagues, the nurses, the doctors, everyone who, despite all odds, they still step out to carry on their duties.
Now, let's take the conversation to the studio now. Ayodiji, for the past 1 year, we have had the pandemic with us. What are the lessons you think we should learn from our experience? What lessons should we draw out of our experience for this 1 year that we should build on and perhaps bridge the gaps moving forward?
All right. When the pandemic first started, there was lockdown. Lots of people can't travel out of the country, including our own politicians. They're forced to get care in this country. If they have put in the best to have well-equipped health facilities, then there won't be fear of running out of the country. A lot of healthcare professionals have left this country. I have about 15 of my friends that left this year. The workforce is reducing because they're being paid outside Nigeria than the peanuts they are getting here, despite the work overload. So if we can put in our best to equip our healthcare facilities, to equip our healthcare professionals, and sensitize the public on how to stay healthy. There was a rule against more gatherings for the people out there, but our politicians are having political rallies. So is the rule just for the public and sidelining some set of people? If everyone is governed by the rule for us to stay healthy, the work overload will be reduced
for the
healthcare professionals, and there will be more elderly people out there. So let's stay healthy. Let's focus on some scientific principles. Let's equip our own facilities and put in the best for our healthcare.
All right. Before I come to Julie, before I come to the issue of the lessons to be learned, now where Nigeria is expecting vaccines perhaps next month, and there are talks about perhaps we should prioritize health workers first. Some other persons are saying we should prioritize those that are vulnerable. For you, where should we begin?
I think first we should protect the health workers. We need to protect the health workers. We cannot begin to protect those who are vulnerable, and then those who will take care of those who will keep falling ill, because the illness isn't going to stop. So we need to, first of all, save those who are saving people. Then the next would be the vulnerable. We have the pregnant women, we have the elderly people. We need to have them also in that priority list. So I think the health workers should be the first to receive the vaccines, and then we'll move on to others. That would be my thought.
Now, with the myriad of issues that you and Ayodeji have pointed out, there are concerns by WHO that perhaps there could be a global shortage of health workers by 2030, mostly in low and middle income countries. And if we are to draw lessons and to also avert that, what should we do moving forward? Now that we have learned certain lessons, we have seen the gaps in the past 1 year, where should we begin to bridge the gaps?
All right, thank you. So we need to, first of all, encourage families to encourage their children to take up the medical profession. So we need medical doctors, we need nurses. Now, that will not be sufficient, because they are saying that the healthcare workers are in high demand in other climes, in first world countries. So they would want the tendencies for them to say, oh, go into nursing, go into medicine, so that you can move to another country and have a better life for you, yourself, and us. So while we're encouraging young people to take up the medical profession as a choice of career, let's also have our government improve the working conditions of our healthcare workers, improve our facilities, make equipment available, improve on the remuneration, because we really cannot stop people from leaving. 2 of my assistants are leaving. 2 of my partners are ready. They're just waiting for just one little detail to leave. I have collaborators who have left the country, and I get the call every day. Julie, what are you still doing here? So it's a lot that needs to be done. We need more people. We need to create scholarships. For those who have gone, we have Nigerians in diaspora, health workers, nurses that I know of, and I know medical doctors are doing the same. They are providing scholarship for young people to go into nursing. I'm sure medical doctors are doing the same thing as well. So as we are encouraging young people to take up this profession, let's make this available. Let's make our healthcare system conducive for people to work. That is the way that I think that we can manage and avert, because there will be a shortage come 2030. Before that, we're experiencing it already in our different hospitals. We need more people. So let's improve our educational system. Let's empower people. Let's share and shift tasks. There are some responsibilities that can be shifted from the medical doctors to the nurses. We need to upgrade the nurses. We have nurse practitioners in other clients. We have nursing assistants. Let's upgrade our educational program and system for healthcare workers. Let's sponsor people to go in and take these programs as a choice of career. And let's have the government do their bit as well.
All right, Julie Mwogbo, Executive Director, Royal Nursing Consult, as well as Executive Director, Nurses on Air, Ayodeji Owolabi. Thank you for your time on the program.
Thank you.